Hello guys, welcome back to All in Law. In this video lecture, I am going to talk about a temporary teeth and the permanent teeth briefly. So there are two types of teeth. We know that temporary teeth and the permanent teeth. The temporary teeth will appear first and that permanent teeth will appear later in the life. So what is the basic thing that you should know about the primary teeth? What we are concerned about is a temporary teeth or a primary dentition. Remember, the primary teeth total are 20 in number. Okay, whereas a permanent teeth, I will write as a permanent teeth. Permanent teeth is, we know that it's a 32 in number, right? So the temporary teeth, I would like to talk about the temporary teeth. The temporary teeth, as it's so more concern for the parents, that temporary teeth, that the child is not having temporary teeth, all these things. So let's talk about this, when you should worry about, and if the child doesn't get the temporary teeth, when you should worry about, and what are the things that you should look for, and when you should visit the doctor. So if you talk about the temporary teeth or a primary teeth, we know that there are 20 in numbers. The first teeth might appear around the age of 6 months. 6 months is the first temporary teeth to appear. If you ask me which is the teeth that gonna appear first, is a incisor teeth. And if you ask me further which type of incisor teeth will appear first, it is a lower central incisor. Okay, lower central incisor. Look, there is a one point over here, is a 6 months is the first teeth to appear, right, at 6 months of age, but it can go up to slowly what happens, the teeth starts to appear. So the 20 numbers will be completed by 2.5 months. 2.5 years. 2.5 years. So by 2.5 years, the child will have all the temporary teeth. So for example, if the baby doesn't have the first temporary teeth at the 6 months of age, then you no need to worry. Just go ahead, continue the nutrition, continue whatever you are doing. Unless until it's a failure to thrive, then you need to visit a doctor. Otherwise, if the weight is good, just give some time till the age of 2.5 years. By 2.5 years, he should have all the teeth. And 99% it will be there if the child is doing well on nutrition. There are some causes, the most common cause being the vitamin D deficiency in developing countries. Okay, and the third molar erupts at around 17 years of age in permanent teeth. So now let's talk about there is a mnemonic to remember the temporary teeth, how they appear. There is a mnemonic. I will write over here IMCM. So remember, this is the incisor. Okay, the first one what we talked about is the incisor, then the molar, the canines, and the molars, the first molar and the second molar. So if you want particularly at what age the teeth appear, is the primary will appear, the first lower central incisor will appear around, remember always there is a range, there is no strict dictum that it should appear at 6 months of age. It can vary from 6 to 10 months. Okay, well then the first molar will appear around 10 to 16 months or sometimes 15 months too. Canines will appear on 16 to 20 months, whereas the second molar will appear on 20 to 30 months. Well, shedding, if you ask me the shedding of the temporary teeth, when they do shed, is the incisor will shed around 6 to 9 years. So remember, 6 to 9 years, the age where the child starts to have a permanent teeth. Okay, the molar will disappear, will start shedding by 10 to 12 years, and the canines will start from around 9 to 12 years, and the last one, the molar one, the second molar one will start shedding around 10 to 13 years. So this is regarding the temporary teeth. The one important thing that you should remember is that dentition is not dependable variable to assess the growth, as what you call the timing varies widely and is not related to the nutrition. So most of the thing that we think that nutrition might be the cause, sometimes baby take time to get the temporary teeth. It varies actually. Okay, now talk about the temporary teeth. We have talked about temporary teeth. Now let's move on to the permanent teeth. Let me add on to the page and let's see. Okay, so permanent teeth, as we know, they are 32 in number. As we know that the temporary teeth should complete by 2.5 years. The child should have temporary teeth by 2.5 years. If he is not having, then he should visit the pediatrician. If you talk about the there is another one I would like to tell you. There is one formula to calculate temporary teeth. Number of teeth is equal to, in infancy, is equal to age in months subtract minus 6. Why 6 is a 6 months, remember. So for example, if the baby is around 10 months, 10 minus 6, he should have 4 teeth. But remember, this is not the must that child should or infant should have 4 teeth by 10 months of age. It can vary, but take a dictum that at around 2.5 years the child should have all the temporary teeth. Okay, so now let's talk about the permanent teeth. If you talk about the permanent teeth, they erupt around, I told you earlier that they erupt around 6 years, right? 6 to 7 years, sometimes 8 years also. So how do they appear? There is a mnemonic for that also. There is a mnemonic MIPCN. M stands for molar 1, it's around 6 years, and the incisors 7 to 9 years, premolars 10 to 12 years, and canines around 11 to 12 years, and the molar, there will be 2 types of molar, one the second and the third molar. As you know, the second molar will appear around 13 to 14 years, whereas the third molar, it varies up to 25 years also. So these are very important. Okay, remember one more thing is the assessment by the stages of ossification of teeth, as seen in the jaw x-rays, is more reliable. Okay, when do you call dentition is delayed? When do you call? When there is no tooth erupt by around 13 months. Remember this, if by 13 months of age still the baby doesn't have the teeth, temporary teeth, then you should worry and visit the nearby pediatrician. Okay guys, well, if you ask me what are the causes for delayed dentition, there are a lot of causes mentioned in the books. So one, you remember the familial is the most common. Then it can be due to the hypothyroidism, malnutrition, hypoparathyroidism. Okay guys, thank you so much for watching this video. Take care, bye, and do subscribe to our video and hit the notification bell icon. Thank you. Okay guys, take care, bye.